Have you ever experienced a significant life change that affected your mental health dramatically? Are you familiar with the term adjustment disorder? If not, you're in the right place. Adjustment disorder, sometimes referred to as situational depression, is a common psychological reaction to identifiable stressors or changes in one's life. These can range from the loss of a loved one, a career transition, or even a global pandemic. It's the emotional and behavioral distress that's out of proportion to the severity of the stressor, and it typically occurs within 3 months of the stressor. Now, what's important to understand is that adjustment disorder is not a sign of weakness or a character flaw. It's a normal response to abnormal circumstances. It's human to struggle when life throws a curveball your way. But when these struggles start to interfere with your daily life, relationships, or work, they may be symptoms of adjustment disorder. Unfortunately, adjustment disorder is often overlooked or misunderstood. Too often, people chalk it up to just having a bad day or going through a rough patch. But it's more than that, and recognizing it is the first step towards managing it. Imagine a person who has recently moved to a new city for work. They're away from their family, their friends, and everything familiar. They feel isolated, anxious, and depressed. Their work performance suffers, relationships strain, and they're constantly overwhelmed. This could very well be a case of adjustment disorder. But remember, adjustment disorder is temporary and treatable. With the right support and treatment, people with adjustment disorder can return to their former level of functioning and enjoy life again. It's crucial for us to spread awareness about adjustment disorder. The more we understand it, the better equipped we are to recognize it in ourselves and others and seek the necessary help. Now that we have a basic understanding of adjustment disorder, let's dive deeper into the diagnostic criteria. So, how do professionals diagnose adjustment disorder? They use a guide known as the DSM 5TR. The Diagnostic and Statistical Manual of Mental Disorders, 5th edition, text revision, or DSM 5TR, is the definitive guidebook for mental health professionals. It provides a comprehensive overview of various mental health conditions, their symptoms, and criteria for diagnosis, including adjustment disorder. Adjustment disorder is a stress-related condition that occurs when an individual struggles to cope with or adjust to a significant life event or change. The DSM 5TR outlines several key criteria that need to be met for a diagnosis of adjustment disorder. Firstly, the emotional or behavioral symptoms must begin within 3 months of the identified stressor occurring. This stressor could be anything from a major life change like moving or a job loss to a traumatic event such as a natural disaster or personal loss. Secondly, these symptoms or behaviors must be out of proportion to the severity or intensity of the stressor, even taking into account the external context and cultural factors that might influence symptom severity. Essentially, the reaction is stronger or lasts longer than what would typically be expected. Thirdly, the distress and functional impairment must not persist for longer than 6 months after the stressor or its consequences have terminated. If the symptoms continue beyond this, a different diagnosis might be more appropriate. The DSM 5TR also categorizes adjustment disorder into 6 subtypes based on the predominant symptoms, with depressed mood, with anxiety, with mixed anxiety and depressed mood, with disturbance of conduct, with mixed disturbance of emotions and conduct, and unspecified. Each subtype has its unique symptoms and diagnostic criteria, providing a more specific framework for diagnosis. So, a professional would use these criteria along with their clinical judgment to diagnose adjustment disorder. They would also rule out other mental health disorders that might better explain the symptoms, ensuring an accurate diagnosis. With the criteria clear, we can now explore the causes and symptoms of adjustment disorder. What triggers adjustment disorder and how does it manifest itself? Let's find out. Adjustment disorder, often referred to as situational depression, is essentially our mind's response to stress. It's caused by a significant life change or a series of stressful events. These could be anything from losing a loved one, getting divorced, or being diagnosed with a serious illness, to less obvious triggers like retirement, a big move, or even graduating from school. Essentially, if it's a major change that causes stress, it could lead to adjustment disorder. Now, it's important to understand that we all react to stress differently. What might be a minor inconvenience for one person could be a major source of anxiety for another. That's why the causes of adjustment disorder can vary so widely. But what about the symptoms? How can you tell if you or someone you know is struggling with adjustment disorder? Well, symptoms usually begin within 3 months of the stressful event and rarely last longer than 6 months after the stressor has ended. These symptoms can be grouped into 6 categories: depression, anxiety, a mixture of depression and anxiety, disturbance of conduct, a mixture of emotional symptoms with a disturbance of conduct, and unspecified, which includes physical symptoms. Depressive symptoms might include feeling sad, hopeless, or not enjoying things you used to love. Anxiety symptoms could look like feeling worried, tense, or having difficulty concentrating or sleeping. Disturbances of conduct could mean you're violating rights of others or societal norms. If you're experiencing a mixture, you could be showing symptoms from multiple categories. Remember, it's not just about feeling down or worried. It's about these feelings being so intense that they interfere with your daily life. If you're struggling to go about your day, or if these feelings persist for longer than would typically be expected after a stressful event, you could be dealing with adjustment disorder. Now that we know what to look for, we should explore how to manage or treat adjustment disorder. Fortunately, adjustment disorder is treatable, but what does treatment look like? Well, let's dive into that. The treatment for adjustment disorder is as diverse as the people it affects. It's not a one-size-fits-all approach, and it's tailored to the individual's specific needs and circumstances. First off, there's psychotherapy, also known as talk therapy. This is often the first line of treatment. It involves talking with a mental health professional to understand and cope with the stressor causing the disorder. Cognitive behavioral therapy, or CBT, is a type of psychotherapy that's frequently used. It helps individuals identify and change thought patterns that lead to harmful behaviors or feelings of distress. Now let's talk about medication. While there's no specific drug to treat adjustment disorder, certain medications can help manage symptoms. Antidepressants can help if you're feeling depressed or anxious. Similarly, anti-anxiety medications might be an option if anxiety is a major symptom. But remember, medication is often most effective when combined with psychotherapy. Lifestyle changes can also play a crucial role in treatment. Regular physical exercise, a healthy diet, sufficient sleep, these are all vital in maintaining mental well-being. Activities like yoga and meditation can also help reduce stress and increase emotional resilience. Then there's support groups. Sometimes sharing your experiences with others who are going through similar struggles can provide a sense of community and understanding. It can be incredibly therapeutic to know you're not alone. Lastly, it's important to remember that professional help is key in this journey. Whether it's a psychiatrist, a psychologist, or a licensed counselor, these professionals have the training and the expertise to guide you through the healing process. Treatment for adjustment disorder is not a quick fix. It requires time, patience, and commitment. But it's important to remember that it's okay to ask for help and it's okay to accept it. While the journey may be challenging, remember that help is always available. Your mental health is worth fighting for, and there's a whole world of support out there ready and waiting to lend a hand. For more insights into psychology and mental health, PsyEduInsights is here to assist. Welcome to PsyEduInsights, an online platform dedicated to unearthing the intricacies of the human mind. We are an enthusiastic team of psychologists, educators, and mental health advocates committed to demystifying the complex world of psychology for you. Our mission? To make psychology accessible, understandable, and applicable to daily life. At PsyEduInsights, we believe that knowledge is empowerment. We strive to provide a wealth of resources to help you navigate the labyrinth of the human psyche. From enlightening articles and engaging podcasts to interactive webinars and informative videos like this one, we offer a myriad of tools designed to foster understanding and spark curiosity. Whether you're an aspiring psychology student, a seasoned professional, or simply someone seeking to understand mental health better, PsyEduInsights is a treasure trove of knowledge waiting to be explored. We delve into a plethora of topics, from common mental health disorders and their treatments, like the adjustment disorder we discussed today, to the latest research and advancements in the field of psychology. We understand that mental health issues can be daunting. That's why we're not just about education, we're about support too. We aim to create an empathetic, understanding community where experiences can be shared, questions can be asked, and help can be sought. But we're not stopping there. We're continually evolving, expanding our resources, and striving to reach more people. We're committed to staying at the forefront of the ever-changing landscape of psychology, ensuring that our content is current, relevant, and most importantly, helpful to you. So how can you join us on this journey of discovery? It's simple. Subscribe to our channel and keep up to date with the latest insights into psychology and mental health. You'll be the first to know when we release new content, and you'll be part of a community that values mental health and psychological understanding. Thank you for joining us today. Don't forget to subscribe for more psychology and mental health insights. Until next time, take care of your mental health.